It's recording.
Okay, so our group chose music therapy for our expressive therapy presentation. We have Mimi, I'm Christina, and Alexa. So what is music therapy? So according from the book, it is the use of music by a professional to invoke positive change regarding psychological, physical, cognitive, or social functions of individuals dealing with health or educational problems. Music therapy also addresses all different types of multicultural groups, religion, language, race, illness, and sexual orientation. The genre and type of instrument is tailored to the individual and to the goals that are established between the client and the music therapist determine what music is played throughout this therapy. So the music therapist chooses what music the client prefers to listen to and what they think would help them best. So the history of music therapy. So it goes back all the way from after World War I and World War II, when a community of magicians, professional or not, people that just enjoy music, would visit veteran hospitals around the country to play for veterans that suffered from physical and emotional trauma from the wars. They realized that you can tell in the pictures from present day that they really enjoy music and while they're not well in a hospital bed. The American Music Therapy Association was founded in 1998 as a union of the National Association for Music Therapy and the American Association for Music Therapy, which is also a huge component of music therapy because the American Music Therapy Association mission is to progressively development of the therapeutic use of music and rehabilitation, special education, and community settings.
Okay, so to become a music therapist, an individual has to be a music therapy curriculum, and then it includes internships, and then they are nationally examined by the Certification Board of Music Therapists. After a person will hold the Music Therapist Board certification credentials, music therapist purpose is to assess emotional well-being, physical health, social functioning, communication, and cognitive skills through musical responses. So music is designed in sessions for individuals and also in groups. A lot of things that are done in these sessions is songwriting, lyric discussion, music imagery, music performance, and learning through music. People participate in interdisciplinary treatment planning, ongoing evaluation, and then they have follow-ups as well.
So the efficacy of music therapy. So music therapy actually helps like lower blood pressure and reduces heart rate and relaxes muscles if they're tense. It improves vital signs because it also increases a patient's overall level of comfort, including anxiety and other similar factors. Musical experiences also allow people to explore and understand how it can help them. If someone has trouble with their words when sharing events or stories, they can use music to help convey what they mean exactly. Music also calms and benefits the patient no matter the environment that they're in. And The counselor needs to be fully aware as well of a client's cultural beliefs, so nothing interferes with the clients in terms of cultural differences. Music therapy is also growing and developing, um, and there's also um, different groups or different populations that can benefit from music therapy, from children to adolescents, adults, and it can help with a bunch of different injuries or learning disabilities, especially with the elderly and their mental health, developmental needs. Also, like Alzheimer's disease and other related conditions. Um, Substance abuse problems and brain injuries like TBIs, traumatic brain injuries, physical disabilities, and both acute and chronic pain to mothers in labor as well.
So the limitations of music therapy, like every other therapy, there is the pros and cons to it. So some of the limitations to this type of therapy is that it may not work for every individual. It just depends on the client and then the counselor that they're dealing with. So music therapy should internationally there is limited research on cross-cultural music therapy, and clinicians that work in cross-cultural settings must acknowledge these social identifiers such as cultural norms and race. So there should be, oftentimes most of the research is done on Western culture or American culture. And by having more theories that acknowledge many more cultures, it allows people to be able to practice them with people who are from different cultures as well. So another limitation can be is an individual's social economic status. This may contribute to why they aren't receiving therapy and why they may not have music therapy as an option. So stuff things like Medicare, Medicaid, private insurances, and other sources are the cause of why individuals can't receive music therapy.
So the use of music therapy has been used in hospitals, schools, psychiatric facilities, um, private clinics, rehabilitative facilities, medical hospitals, outpatient clinics, just a plethora of different um, facilities, daycares, agencies working with developmental disabilities as well, and community mental health centers. And like I mentioned earlier, with the substance abuse, that they also have drug and alcohol programs and senior centers and nursing homes as well that benefit from music therapy. It could also be used in hospice programs or correctional facilities and halfway houses too. Um, so it can also be practiced worldwide. So internationally, music therapy is um, highly acclaimed and can also be used on a healthy individual. You don't have to be sick or ill in order to benefit from music therapy. It's used for stress and music making, like drums and beats too.
So we went ahead and added some visuals of what happens to the brain when someone is listening to music or playing music. So that was just something that we wanted you guys to look at. There's a lot that happens. For example, like the motor cortex, it's involved in the movement while dancing or playing an instrument, and all the other things like listening to sounds and music memories, reading music. A lot of it is movement. And then on the other side, it shows the brain's reaction to music, again, in a different type of visual. So on the left side, it's the brain at rest, and then on the right side is the reaction of the brain to music. So you see it's more a good visual there.
So the case study that we decided to touch on is a case of a male named Greg. He is 85 years old and diagnosed with dementia for about 5 years now. And throughout the 5 years, his dementia has continuously progressed. His family and friends noticed that he's not able to talk on some days or able to participate in recreational activities. His cognitive and mental processing gives him a disadvantage as well in doing certain activities because he requires extra assistance with being able to do those activities. So, looking at his case with music therapy applied, his Greg's friends and family, they met with the music therapist and they were impressed with its impact on individuals, and they asked the therapist if she could do individual sessions with Greg. Um, and group sessions while other individuals with the other individuals in the assisted living facility. So the goal of music therapy with him is to help find something that will be beneficial to his mental and physical well-being as as well as an activity that he can do even with his cognitive disadvantages. And I will now link over a video with our demo um, that we're doing, or either, sorry, it'll be real time, I think. But give me 1 second. Can you see the screen? Oh, wait. Oh my. So, okay. Can you see my screen? Can you see my screen? Okay.
Yeah.
So we're gonna talk about a couple other slides now. Let's see, before this, here we go.
Okay, so before we show you our demonstration, we wanted to talk about some major approaches to music therapy that our book mentions. So our book mentions behavioral music therapy, and this is focused on helping an individual's behavior, either bad behavior or to incorporate good behavior. There is also developmental music therapy. This is used to achieve developmental goals that have either been delayed or blocked during psychosocial growth. There is also music therapy, music psychotherapy, and in this type of therapy, you wouldn't actively listen to music. It would be more of talking through music lyrics and then what they mean to the client or how they make the client feel. There is also medical music therapy, which is focused on helping restore or maintain physical and emotional well-being through the process of receiving medical treatment. So sometimes individuals who are in the hospital setting for a long time, or if they're just receiving treatment for maybe a heart attack or a stroke, they may get a little lonely in the hospital, and individuals will go in there and play music for them or just listen to music with them to make them feel more comfortable. And another approach is humanistic music therapy, which is focused on helping a client achieve self-actualization and personal meaning.
So another kind of more detailed music therapy techniques that we wanted to include were drumming, which was mentioned in a different slide when talking about healthier individuals. It's kind of, or just anyone to begin with, it's kind of like an amusing thing to just drum. Listening to live or recorded music assisted with relaxation techniques. For example, I know some people that like to listen to like rain sounds when they go to sleep. Playing instruments, hand percussion kind of ties into drumming, music and imagery, and discussing song lyrics. I know that most songs have a, yes, the beat may be nice, but lyrics also tie into some things that can be meaningful as well. And then practice of music therapy kind of ties in of like who benefits from music therapy, like we also had mentioned. So music therapy with premature infants, music therapy and developmental delays, and music therapy in a palliative care. So that also kind of ties in with people that need more assistance, and music therapy, it could really help them as well.
Okay, so now we are going to show you guys our demonstration and application of our music therapy.
Why would I go back?